to like
All right, so I think we can give it one more minute just to allow folks to trickle in and then we'll get started. All right, I think we have a good number to get us started. Good afternoon, everyone. Welcome back to Advancing Health Equity Together. On behalf of the Community Engagement Core, I'm so delighted to welcome you back. And for anyone who's here for the first time, we're so happy you can make it. This is really a space and an opportunity for you to learn more about the basics of community engaged research and really also interact with experts on the field and learn from them on how they run their strategies and methodologies in employing a community engaged research. If you want to go back and watch any of our previous sessions, we have a YouTube playlist now, which I'm going to drop in the chat in a little bit, but please feel free to use that as a resource. Our topic today is going to be on exploring positionality in community engaged research. We're going to start with just like providing a little bit of context on why it's important in the work that we do, and then we'll have a great panel presentation, followed obviously by our usual Q&A session, which is your opportunity to ask questions. If you, however, have any questions come up like during the session, please feel free to drop them in the chat and we'll make sure to go back to them. So just to be mindful of our time, I'm just going to jump straight into our topic today. So really understanding our place in the work that we do is really important because it really helps us have better awareness of our social identities, power, privilege in relation to the community we work with. And it really shapes how we understand the world and influences how we show up in our communities as well. So this really has impacts the entire research life cycle, starting from the questions that we ask, how we ask them, the data collection tools that how we collect the data, how we analyze it, and the partnerships that we form. So some key identities to reflect on include race, gender, class, education, language, immigration status, ability, religion, and so on. Um, Positionality can be a tool for health equity if leveraged the right way. It really helps us acknowledge power dynamics by recognizing and disrupting imbalances between researchers and community. It's a tool also for mitigating bias and promoting ethical research by reflecting on our internalized assumptions and worldviews. And then it's also a way of enhancing collaborations by building trust and authenticity in our relationships. And last but not least, it's also how we create more relevant research by designing studies that reflect the real community needs, center the community voices and lived experiences. So as you can see in the image here, it's really something that we must engage in throughout the research process. Um, so now we're just going to take a couple of minutes to really just reflect on like our different identities, what identities you often think of, or what are the others that you don't often think of on how they come up in the work that you do. If you're comfortable, feel free to share your thoughts in the chat. But we really want this to be just a couple of moments to just kind of reflect, and we're going to go back to it at the end to do a deeper like exercise together. All right. I hope that was a helpful 2 minutes. We're gonna come back to it, but like just keep thinking about it as we're going through the session since we'll do a deeper dive later on. Um, all right, so now today we're honored to have three amazing researchers among us to share their experiences and on this topic with us today. We have Dr. Ksenia Gorbenko, who's an associate professor at the Institute for Healthcare Delivery Science in the Department of Population Health Science and Policy. Trained as a medical sociologist, Dr. Gorbenko leads the Qualitative Hub and leads interdisciplinary projects spanning from health services research, implementation science, and health policy. Her work focuses on improving healthcare delivery through qualitative evaluation of program implementation, including machine learning, AI models, remote patient monitoring, and hospital at-home programs. Dr. Gorbenko is deeply committed to addressing health inequities among racial, ethnic, and social sexual minorities through human-centered design and community-based participatory research methods. Next, we have Dr. Devin Madden, who's an associate director in the Office of Career Opportunity and Support and a member of the Institute for Health Equity Research within the Department of Population Health Science and Policy at the Icahn School of Medicine at Mount Sinai. They obtained their PhD in education and leadership from Pacific University in August 2024 and have their MPH. Dr. Madden is a return to Mount Sinai. From 2011 to 2014. She managed a CDC chronic disease disparities grant before joining NYC Public Schools to oversee reproductive and LGBTQ health programs citywide. Dr. Madden returned to Mount Sinai in 2019 and since then has been working to advance health and gender equity through community engaged in workforce research. As an independent researcher and team scientist, Dr. Madden employs multi-method qualitative and survey research using community-based participatory research approaches. And last but definitely not least, we have Dr. Diana Romero, who's a professor in the Department of Community Health and Social Sciences and director of the Maternal, Child, and Reproductive and Sexual Health specialization at CUNY Graduate School of Public Health and Health Policy in New York City. Her research interests include reproductive and sexual health and policy, social welfare policies related to the health of poor and low-income populations, and healthcare access among underserved urban populations. Much of her research involves mixed method study designs. She teaches graduate courses in qualitative and quantitative research methods, community health, and reproductive and sexual health policy. She received her PhD and MA in Sociomedical Sciences from Columbia University and MA in Scientific Health and Environmental Reporting from NYU. Thank you so much all for being here with us today. We're so happy to hear and learn from all of you. So I'm just going to pass it straight to you all. If you can just introduce us and tell us a little bit more about the work that you do. And Dr. Gorbenko, if you can kick us off, that'd be great.
Sure. Thank you for this great introduction. Yeah, so I was trained as a medical sociologist, and right now most of my projects are collaborative in nature, and they span a variety of human disease types and medical specialties. And I love learning about new areas and kind of learning from the experts and collaborating in terms of methodology and supporting teams. And I also teach qualitative methods in several settings. Thanks.
Thank you so much, Dr. Madden. You can go next.
Thanks so much. So happy to be here and be a part of this panel. And also, thank you all for joining. Can't wait to hear from some of you during this talk as well. And yeah, I mean, thank you for that great introduction. To Meet, I have been doing community engaged public health work, some of that being research and some of that being programming for over a decade. And I think when you're doing community engaged work, it is an imperative that we think about our positionality and be in a reflexive practice to do that. And so in some of the research that I've done, some of my identities have been more obviously insider and more obviously outsider depending on the context. And so I think those are all things we'll explore today, and excited to dive in with all of you.
Amazing. And Dr. Romero?
Hi, everyone. And likewise, I'm really, really happy to be here and be invited to participate in this conversation. Not to repeat any of the information that Tim had already provided on my background, I guess I would just highlight that while what we're going to talk about tends to be more situated in terms of qualitative research methods many times and community engaged research, I've developed a real appreciation for the value of this process of reflexivity and approaches to engaging with community more broadly. So, beyond qualitative research designs, for example. And I think, there's probably an sort of an important goal that I have, or a priority goal that I have is maybe having this transfer more so over into other types of research approaches. My original training, when I was a doctoral student, was quantitative. My dissertation was quantitative, and I came to qual, afterward. So I think this conversation will sort of help us explore applicability beyond, certain contexts.
Absolutely. And we're so excited to hear all about that. We have a bunch of questions ready for you all today. I'll be co-moderating the session with my colleague, Crispin Goitia, who's also here. But I'll start us off with the first question, which is for you, Dr. Gorbenko. So thinking about like the tools and practices, for example, like writing positionality statements or team reflections, what have you found helpful in this work?
Yeah, thanks so much. Um, so it kind of varies, and I would say that initially, like in my early work, I think writing in a diary during field work was very helpful. I think it was also more helpful at that time because I was a novice in the setting, and so a lot of the things. I think that the biggest question every day was kind of like, what was surprising? How did I feel about this? And so just kind of reflecting on what's going on. And then I think I haven't been doing that lately. And partially, I would say it's because most of my projects have been in teams, and it's almost never a solo researcher exploring a topic. I think in for example, dissertation type research, when you are a solo researcher, pretty much with mentors, it's probably very helpful, and I would encourage people to do that. But I think in teams, I think we kind of try to incorporate it. It's probably these discussions happen in every meeting. Like if we have bi-weekly meeting, we always kind of try to set aside some time to reflect and not just do the logistics of the project. And then structurally, we also try to build it into the everyday ongoing thing of the project, like kind of like the how we do it step by step. So I'll give you an example. In rapid qualitative projects, we usually have templates. So we complete an interview and we fill out the information in the preset template. So it's almost like a deductive way to the analysis, and it accelerates your analysis a little bit. So in that, we usually have content areas that are covered in the interview, but we also include something like what was surprising, or how did we feel about this, or was there any emotional responses or emotions expressed by the interviewee that are important to reflect on and to discuss as a group, or should it affect how we go ahead with the rest of the project?
Yeah, those are actually very helpful tools. Um, yeah, and Crispin, if you wanna, do you want me to ask the next question?
Yes, absolutely. Thank you. Um, and so, beyond personal reflection, how important is it to also examine the institutions and systems we work within? And this is for Dr. Romero.
Sure. Yeah, I'm really glad you asked this question because oftentimes we might just default to individuals. You know, if we're doing public health related work that seeks to improve, you know, experiences that can have an impact on individuals' health status and and experiences, we tend to just maybe just focus at that unit of analysis. But you know, I think sort of in the socioecological model, it's very clear that there are all these different levels and that individuals are within communities, and that beyond that, there are institutions and systems that affect them as well. I, you know, just tend to think of oftentimes partners, we are partnering with institutions or organizations who ostensibly are, you know, are then serving or interested in particular communities. And so, for example, these organizations or institutions oftentimes, if not always, have very clearly articulated missions and visions, right? So if the missions are their immediate goals, it's usually quite clear what they see their purpose as being and where their focus is going to be. And that may be a reason why we really want to partner with them, because there's a shared interest there. But at the same time, that may also mean that they have to stay within the bounds, right, of their missions. And that might prevent, not intentionally, but it might certainly prevent the scope of the work, the questions we ask, the groups that are included or excluded. From a research perspective or programmatic perspective, it may make a lot of sense to maybe cast a wider net in terms of questions asked, data collected, communities included, but that might, end up, there may be tension there because it might be much more narrow, or relatively speaking, more narrow from the perspective of the sort of institutions or organizations that were either situated within and or partnering with, right? So that's certainly going to be a tension that would have to be identified and kind of worked through. And then also these institutions may have relationships with other entities that maybe have nothing to do, it seems, with the work that we're doing with them, but just by virtue of, having relationships with other entities, maybe funders, right? Or a relation, maybe it's a community-based organization, a nonprofit organization, but they have a relationship with a municipal agency like the health department or the mayor's, city council, or they're getting funding from a certain funder, that may also limit how much or how they engage in work that they're collaborating or that we're collaborating with them, but we may not even be aware of it, and I'm speaking with the hat of a researcher, of an academic researcher that does a lot of community-based work. So this is probably as a result of stumbling upon these things over the years. But I give one quick example from work I did quite some time ago, so that maybe it's not, problematic, but I was one of the leads on this work with multiple partners here in New York City when St. Vincent's Hospital had been closed, or was in the process of being closed. And we were doing an assessment of the impact of that. And we had multiple partners. We had the speaker of the city council who was spearheading some of this. There was a large healthcare provider from the metropolitan area who is providing, quote, pro bono support, but certainly would have, interest in how things went. We were working with many, upwards of 30 or 40 community-based providers, organizations, healthcare providers, etc. And we bumped up against things along the way. It was collaborative and it was successful ultimately, but because of some of the things I mentioned, maybe competition, unknown relationships, and each of those entities, including our own missions or goals, there were definitely many points along the way to kind of stop and recognize these issues and and address them. So reflection in advance of these kinds of issues is absolutely, ideal. I'll leave it there.
That's actually a perfect segue to our next question. And as you said, it's very important to, like we form relationships with oftentimes like organizations with shared interests, but other times with like that may not be the case, but either ways, we need to engage in reflections. So Dr. Madden, how do we create the space for open and honest conversations about power, privilege, even within, it can be within the research teams or with the communities that we partner with?
My brain is going in like 12 different directions right now. There are so many spaces I want to take this. I want to just say, like, first, Dr. Grabenko, I love what you said about creating time within teams for folks to actually have these conversations. I feel like so often I'm in spaces where we're kind of like floating around what we want to say, right? And like, but actually creating that trust, being authentic with one another in that team setting and getting into some of these tough conversations is really helpful and necessary. And I don't think it's a practice that enough of us do when we're doing any kind of analysis together, or even building messages to recruit participants into studies, right? I think sometimes we just sort of skirt around these ideas. So I love that you create those spaces. And Dr. Romero, I'm thinking about just obviously this current point in time and doing research as a person who belongs to an institution. And I'm thinking right now of two very distinct projects that we have going on. One that is with other health equity researchers, and what that messaging looks like, considering many of them may feel similarly to how we do, but many of them may have different levels of comfort with certain things than we do or not. And right, how does that sort of play into how we build the messaging out to recruit them in, and the questions that we ask, so that it is a little bit more sensitive to people on all sides of the spectrum, in terms of what they feel like they can say, knowing that they may also be parts of institutions and want to and need to be protected. And I'm thinking about work that we're doing with patients and communities who may be feeling a certain way because of things they feel are or are not being said. And that's sort of been something we're more comfortable exploring historically, right? Because there has always been this sort of earned distrust between communities and academic institutions, where what is that relationship? Is there a mutuality? Is there a trust? Is there a respect? And so we have had to be more intentional and thoughtful about our messages and the way that we bring people in. But it is really right now very in our face, just based on some of the things that are happening. I also have just found that when research is participatory and relationships are being built and people are diving into the work themselves alongside you or with you, then these conversations inevitably and organically often do come out. But you have to build that trust. And that's why I think participatory methods are obviously so critical to a lot of the work that we do in health equity spaces, particularly when we're dealing with or working with populations who do have that earned mistrust. Having that participatory reciprocity in the research process, I think, just because it is meant to disrupt some of those power dynamics, allows you to get into the weeds and have those conversations. And I will just say that as an example, when I was working on my dissertation, which was a participatory narrative inquiry study with a group of bisexual plus femmes here in New York City, we spent many Saturdays together, very long sessions together to meet. You were there for all of them. And at the beginning, conversations around race, ethnicity, power, privilege, class, religion, those were not topics that were coming out in the first couple of sessions. But by the last session, because the participants had built so much comfort with one another and knew that the space was a space that they were creating, the results were going to be results that they put their stamp of approval on, they got into it. Like that was when it like opened up, the doors just opened up and they were able to have those conversations. So I think a lot of this can come organically, but it does take time, and it does take making sure that the approaches you're using are kind of aligned with this sort of vision of disrupting some of the hierarchies and interrupting the way that power can be oppressive in research. So that just kind of comes with it. And I also just want to point out that, like, I am so lucky to work with, I'm going to shout out Getty Ernie here, because while we don't always necessarily take the time in team meetings to discuss everything, and I work closely with Dr. Neetha Vangipuram and Tim Neat and Crispin, and we do have a lot of these conversations because we have those relationships. But also Getty always bringing up language and language access and language justice, and reminding me and all of our colleagues that, like, we have sometimes a vocabulary that is inaccessible. This is not necessarily something that we always think about when we're talking about positionality. But when you thought about that, when you looked at that identity wheel and you thought about communication styles and education, this plays into the research that we build and put out. And so I'm just also grateful to all of my colleagues, but especially Getty, for the language piece of calling us forward to be reflexive.
Timnit, would it be okay to ask a question, just kind of based on our discussion?
Yeah.
Yeah, just kind of going off what my two colleagues, Dr. Romero and Dr. Madden, said about structural influences on our positionality and on our research. I was thinking, I've been noticing that sometimes there are situations when researchers come to me with a research question, with an idea for an intervention, which after talking a little bit to them, I realize is a project that should never happen. And so it's a little bit, it usually is an issue of structural problem that, like, there's some conflict. So for example, yes, ideally we would like to do this. However, we do not have enough staff, and there will be a huge pushback, and not, like, people will not want to go along with it, or something else like that. So it's usually something structural and something institutional and something big that we realize exists there, and it's a project that just cannot happen right now. Not should not, but cannot, right? So have you had situations like that, or any experience with it? I guess I'm asking a question to the audience as well, but to my colleagues, if they have some thoughts and how it relates to positionality.
I think that's, yeah.
Sorry, Dr. Urbango, could you just say the question in one? I was admittedly looking in the chat and lost the thread of the question.
Yeah, so have you had the situation when you are working on a project, or somebody tells you about the project, and you realize that the more you learn about this, that there's some institutional barrier for the project to happen? And, like, how do you deal with that? And usually it has to do with structure.
I think it's a great question, and I was trying to think. My silence was, thinking of maybe examples or experiences where that's happened. And I have to say that maybe I'm just really fortunate in that nothing overt comes to mind. And that may be because, and I don't know if you're just talking our primary institutions or just institutions in general that we interact at, or it could be both.
Oh, yeah.
Yeah, what I guess, anytime maybe a challenge has come up, I've just thought of it as like, that's the natural course of doing community engaged work. And I define community very broadly. It's like the realm of stakeholders that have some interest and important and, relevance to whatever project we're working on. And it could be across various sectors, not just maybe nonprofit, more community focused organizations. So anyway, I think barriers and challenges probably are fairly common, but I've never thought of, but I just thought, I guess I would expect that's the nature of what we do. And I feel like they've always been learning opportunities and probably helped to actually build relationships. But I don't know if that's just too Pollyanna, Pollyanna-ish.
Oh no, that's great. Yeah, maybe yeah, no, maybe you were more fortunate, or maybe I'm there like when the questions are being brainstormed and we have to cut some of them. And so that's an
Yeah.
opportunity to say this one is going to be too challenging. Let's try the one that will actually happen.
Similarly, I think we've been in positions, I feel like we're currently in some positions where it just is not the time because of things that are happening institutionally, politically, societally. It's like the ideas are there, and maybe 2 years ago was the time, and maybe in another 5 years ago it will be the time, but right now is not the time because of just different pressures on us as an institution and as researchers, but also pressure on the people that we're interested in working with, who like just don't have this, like this is not top of mind for them. And I think that's something that we as researchers need to think about too, and part of why I think, again, CBPR approaches are so good. But there's another qualitative project that we've been doing recently, and one of the participants in an interview shared, like, we understand that sometimes you get funding to do XYZ, and that's important. But there needs to be then you coming back to us as the participants and saying, but what would you like to have research on? Like, what's important for us to do from your vantage point? We'll help you because, okay, this is important. We can get behind it, but it's not the top need. And so I think sometimes we do just have to adjust and pivot depending on context and time. And sometimes it's really just like time to shelve something if something else is more pressing for a community.
And I do see that, Getty, you have your hand raised, but I think we're going to save some of the questions for later, just so that we can get through all of our questions now. And Crispin, if you want to jump
Yeah.
in next.
And so for Dr. Gorbenko, when working with communities that we're not a part of, how can we make sure that our limited perspective doesn't unintentionally limit our research goals or outcomes?
Yeah, thank you. Thank you for this question. That's it happens all the time, right? So basically we probably are a member of some in-group in some way. Usually there's a touch point that we can connect with our participants. And sometimes it's really hard to think of one, right? And other times you have maybe one touch point, but it's not their major thing. And then you are trying to find a team member who might be more similar in some ways, who might be able to interview and put people at ease and help them open up in a much better way than you would. So I think it's a very important question, and it just kind of goes back to that reflexivity that you kind of need to keep thinking about what is it that I'm possibly missing, and talking to people. And so hopefully if you have people who are different from yourself on the team, that in those team reflections you might be able to have these discussions, or something might be brought up. And I mean, like I'm thinking right now, like also of the conversation that I think happens in every project for me. Usually we talk about if we have if we are interviewing a diversity of stakeholders, like different people at different levels, we always talk about interviewing up and interviewing down. So the power dynamic. And then we kind of try to assign different members of the team, like who will be more effective at interviewing this person versus this person. So trying to kind of bring it, and it's never perfect, and it does not have to be perfect, but it's kind of like if a student, for example, is interviewing somebody who's very experienced in the field, in the area that you're interviewing, they might just not get deep enough. They might ask questions and the person will just give them kind of stock prepared answers. So you're trying to match them with the most experienced member of the team or whoever has the most expertise on the topic. So if it's like maybe another physician, although I also always try to use the outsider perspective as well. So maybe like it's nice to have a non-clinical person interview a physician so that they actually break things down for you and explain things in greater depth, as opposed to if it's their colleague and they will just talk in abbreviations and think they understand each other, but they didn't actually get deep enough, and maybe there is a huge difference in their perspective as well. So yeah, for sure, just kind of trying to think about other ways that we try to make sure that the community perspective gets like to exert influence on the research. And I guess like an example that comes to mind, that not really community, but it was a project on a machine learning tool, and we interviewed registered dietitians who were supposed to use a malnutrition screen that was predicting which of the patients might get malnutrition. And so this is something that you wouldn't learn if you didn't talk to the people. So the tool was predicting at a certain percent pretty well, right? But when we were talking to the dietitians, they are telling us who the tool doesn't work on, that doesn't work very well on. And one example was amputees. And it just doesn't come to mind when you think of this, but then of course, right? So of course the BMI would be off with this population. And so we wouldn't know that unless we spoke with the people who are the end users, who are the so-called community for this particular tool. I'm going to let my colleagues also chime in if you'd like.
Yeah, no, those were really great points. And I think we do often like a fairly good job in like qualitative research to, have those conversations. And in fact, reflexivity is often associated with qualitative research. But Dr. Romero, and this next question is for you, but how can we use reflexivity to help us like enhance and strengthen other types of research approaches as well?
Yeah, I love that question. Let me just ask you, can you hear the sirens behind me? Or okay, good. So and I love that you asked how can it rather than can it, right? Because I take it as a given for, I think fundamentally there may be a few folks who disagree with this, but by and large, I would say most believe that we can't be entirely objective in probably anything, but if we think about research, it is really I think a disservice in teaching graduate students and the like that certain kinds of research, for example, more quantitative research is objective, and then other kinds, for example, qualitative research has a lot of subjectivity to it. I think it's just a fundamental truth that really no research endeavor can be entirely objective. And if you go with that foundation, then I think the process of reflection throughout the research process, certainly thinking about one's positionality and their experiences and exposures that, might influence the way they think about a topic and that of others that they're working with, can be incredibly valuable and useful. I don't see a distinction with the kind of paradigm methodologic paradigm that we use, whether we're conducting a survey or doing interviews or focus groups. Even secondary data analysis, people may say, well, of course, I'm totally objective. It's the data are all there. I'm just analyzing them. I didn't, but the questions that were asked that collected those data were asked by someone or people or team that brought to it a certain perspective and not another, right? So, but it's not all bad news. It's not like, oh, then let's just give up because we can't be objective. I think it's this reflection and consideration of positionality and other influences, experiences that we have, has no downside to it. All right. It allows us to think very thoughtfully about the research questions we're asking or that we immediately think are important to ask, and then engaging with that reflective process, but also with others, partners, people with lived experience, with other kinds of experience and perspectives, may make it, it may become very obvious very quickly that there are other research questions that can be asked, and probably better ones. So from the very beginning of thinking about a research question or a program to develop and use as an intervention, for example, all the way through what data are collected, what data are not collected, how those questions, survey or interview are framed, the language, the terms that are used, all of those things can benefit from the reflexive process. It just opens things up to broader perspectives and interrogation, and iterative improvement. And again, and it carries through from that very beginning of question formulation or program thoughts and development, all the way through to the data that are or are not collected, the way in which they're analyzed, what variables are included in a model, which ones are not. And then, also can help with the process of interpretation and conclusion. So all of those things that are really common across the board, regardless of the kind of research methodology or paradigm that we use. And I will say that there's just been some recent writings about this, specifically the applicability and benefits of incorporating this reflexivity process in quantitative type of study design, since that's generally not been used.
Thank you so much for that. And so I know we have 2 minutes left, and we had some other questions that we wanted to get through. And this one is for Dr. Madden. When thinking of participatory research methods, how can reflexivity add to the research process?
Okay, and I'm also going to just own that you all can call me Devin. Being reflexive, doctor is still like a hard hat for me to hear my colleagues call me and hear anywhere, honestly. But thank you for the question. I mean, we've covered that we all think, obviously, that reflexivity processes are critical, like they're non-negotiables. It feels like this ethical kind of must-have. And so in those ways, it obviously can add to the research because we're doing research that has integrity. And Dr. Grabanko gave a good example of like making sure that you make decisions and thinking about, how you might pair researchers with interviewees, right? The person on the receiving end of the questions, you want to have the best experience with the research because that helps build up trust in research processes, but it also means you're just going to get better data, right? You're going to get more honest, open communication with the person that you're interviewing if you've kind of thought through some of that. And this isn't always a perfect science, I think. I'm remembering also, again, another qualitative project recently where somebody had talked about, like, I want somebody who is in community with me, somebody who shares my gender experience, because then you won't get textbook information. You'll get the real me, you'll get the raw me. But then there may be other situations where if people share an identity that is salient, people might take for granted that there is this deep understanding of a certain concept or certain thing and not go into as much depth. So there's this sort of like this balancing act to do in thinking through all of these pieces. And then to Dr. Romero's point, bringing it back to research that can, obviously even include quantitative data, think about who is doing the recruitment. When you were talking, Dr. Grabenko, about thinking about who's doing the interview, I was thinking also like, who are we sending to clinic or having call people, and what does that say to potential participants? How do we build trust in even those interactions? And as a team, thinking about those decisions together is really important. Who's helping you explain the study? Who are you thinking about having test the survey? Who's when you look at these validated tools, like, who have they actually been validated with? And are you just taking them because they come from these sources that you know, or are they going to actually work with communities that you're working with? And so I think it's really important to ask all of those questions so that we can get the best data that we can get. And I also just want to say, and this is like a little bit kind of self-serving in a way, but this is hard work. Like, research is hard work, and it's work that we all get into because we really care about. And particularly, for me, when I'm doing work around sexual and gender identities, it can bring up a lot for me because I am in community in a lot of ways with the people that I'm researching, and I'm out of communities in a lot of ways from the people that I'm working with. And so I think reflexivity is also like a little bit healing. And it allows you to kind of create some sort of like boundaries when things might become a little bit messy. And so this goes a little bit back to the question, Timnit, that you asked Sania earlier about like what tools you use. And this is a little bit personal, but I'll share it. When I was working on my dissertation, some of my like empath boundaries were becoming a little bit like I was becoming enmeshed in certain stories. And so I went to one of my therapists, a queer therapist that I knew would kind of understand where I was coming from. She knew me, and she told me like I really needed to create rituals around my time with the data, something that would kind of like signal to my brain and my heart, you're entering into data mode now. And then something that would kind of signal my exit so that I could really care for the stories because they deserved that, but also care for myself. And so I'll just leave it at that. But I think, having that process allows you to not only get the best data that you can get, but also make sure that you're whole throughout the process too.
Wow, that was very helpful. Thank you so much for sharing that. Crispin and I came prepared with many more questions, but in the interest of time, we're going to jump into the reflection activity together. So I'm going to start sharing my screen. Screen. All right, can you see it? All right, perfect. So what we're going to do is we're going to start by reflecting on our social identities and think about what potential biases or blind spots we may have in the research that we do, or, like any work that we do. We can access the Slido either by scanning the QR code, or you can also just go to slido.com and just punch in those numbers. Those are all great points and reflection points. Definitely education, thinking style, accessibility, communication style. Oh, wow. I hadn't even thought of that before, but definitely true. Um, growing up in a different country, language, familiarity with different histories. All of those are great points. All right, we're gonna give it one more minute and then transitioning to our next question. All right. And now our second reflection point is to, again, think about our social identities, but this time think about what strengths we bring to the research that we do. So many great points. I think this is really evidence that reflexivity also helps us really even like strengthen the qualities that we already have and bring that into the research that we do. We have empathy, passion and thoughtfulness, ability to listen, all very important, ethnic perspectives, curiosity, active listening, definitely. All right, we're gonna give it one more minute and then we'll just make time for the Q&A. All right. So I think we're just going to take the next 4 to 5 minutes to just take any questions. I know, Getty, you have one, so you can go first.
Well, I think the the discussion that followed my raising my hand sort of reflected on everything I wanted to say. I think that there's no way that you could do this kind of work and be cognizant of the positionality without having people that you're studying at the table. It would limit your research, your work. And also, as several of you have mentioned, we do come from a place of tunnel vision, right? I mean, we are only who we are. And so to have input from others, not just the community that you're trying to study, but the colleagues that you are surrounding yourself with and working with, and listening to the input that each person has, I think, is incredibly invaluable. And the work, like a couple of you said, that you may not know the questions that may be important, that you haven't thought of. So to be as inclusive as possible and to absolutely have folks at the table, to learn from them. If you're not necessarily planted in that community, you really need to learn about them and have their input for your work.
Thank you so much, Getty. Do we have any other questions?
If I could just, I don't want to cut any, but I don't see any questions. If I could just make a comment. I really thought it was great, the connection for me between what Devin's last said in terms of their own, process in working with data and reflection and all, and what Dr. Gorbenko said earlier on about when you're working with teams, oftentimes that just becomes sort of an integrated part of sort of team meetings and debriefs, and it may not have to happen solo. It made me think right away of a project I've been working on for the last 2 years, and we're writing papers now, but we had a huge data set, 750 narratives that we were analyzing qualitatively in a collaboration with the Office of the Chief Medical Examiner here in New York City, and their narratives from next of kin of people who died of overdose. And it's really heavy stuff, and 750 of them, and it's from the next of kin, so it's just layered. And we would normally do reflection in the beginning and throughout a project, just because we want the data to be, the process and the data to be as rigorous as possible, and identify potential influences, et cetera, et cetera. But in this case, it was hard stuff. And so we very intentionally incorporated reflection and checking in throughout data analysis, because we anticipated that reading all these narratives was not going to be easy. And so we would have regular meetings anyway for analyzing the data and going through that process, but we really made space for reflection on the potential personal, individual impact as well, not just how are we looking at the data. So the two comments between the beginning and the end of the session really resonated with me, just in terms of that particular project, being an example.
Thank
Yeah,
you
that's
so much for sharing a wealth of information with us today. This has been exceptionally helpful. We're at time, so I just want to be respectful of everyone's time. But please fill out the feedback form. I've dropped that in the chat. And our next session is in September 17th. So please also join us then.
Thank you, everyone.
thank you so much.
Thank you all.